tape. And I'm Dr. Dave Johnson. I'm the board president of the St. Joe Community Health Foundation, and we welcome you here today. This is an exciting time for us. We're taking a pause. We're taking a moment to be mindful and reflective of the work that the foundation has been doing over the past 20 years. We've worked with the poorest of the poor. We've, in doing this particular study, the deeper dive is to understand that poverty here in this community. The St. Joe Foundation, in their service, has gifted and granted almost, almost $20 million to about 221 agencies and programs over the last 20 years. And so it's important for us as we take this pause to really understand the community that we serve. And so we commissioned Purdue Research Institute, did I get that right, Rachel? To embark upon this study. And as we thought about it, to help us with our strategic thinking, we thought it also makes sense to share it, to share this information with all of our community partners as well. So we're glad you're here. We're glad, and I think you will be glad you're here as well, to get this information. And with that, I'd like our Executive Director, Meg Disler, to go ahead and begin to animate what we've done here.
Thank you. It's kind of crazy to use a microphone that doesn't amplify. And I'll get the glasses and all the assistance I need. I thank you, Dr. Dave, and I also want to start off by thanking Rachel Blakeman, who you'll hear from very shortly, a little more in detail, for the great work of Purdue University Fort Wayne's Community Research Institute. When we first met with her to go through this, they're really a gem in the community and helped really assemble a lot of detail into a very simple 418-page report. And so when we first got this back in March, we were very excited, but it's taken us several months to really go through the report and to figure out what we thought would be helpful to us, to inform us in our grant making, decision making, but also to help our community partners. So what I would like to do is share with you a little bit about what some of the findings that are very, we thought were very important to us and to our work. But I can guarantee you it's only the tip of the iceberg. And as you see what's in here and how to use this report, it's actually a wonderful tool that you can use to actually research and figure out how to be more effective in many of the different projects that you all are working on in this room. Just a little bit of a background on us, the St. Joe Foundation, we do about $1.8 million a year in projects and grants in the community. So very selfishly, we started on this journey because we wanted to be better informed, to be more precise. But as we got into this, Rachel helped us see pretty quickly how this would help many of the people in the room and other nonprofits in the community and businesses, government, et cetera. So hopefully, you'll find that as well. So we are videotaping this, and we have materials, and everything will be on the website as well as a guide if you walk away from this and want to do a deeper dive around specific areas that are of interest to you or populations. And you can also work with Rachel and her team if you need some more assistance. We also think this is really important to be very informed because resources are very limited, as we all know, in the community when you're working with vulnerable populations. Income is limited, food is limited, a lot of different areas. So, but there's a lot of opportunity if we do it a little smartly. I will tell you that we've already used these findings pretty effectively in 2 areas that have been beneficial. One is, you may be aware that we run a partnership with Parkview Health called Healthy Eating, Active Living, the HEAL Partnership. When we were able to, with this, identify the food deserts in the community, we located the 41 cooking classes that we're hosting throughout the community, all in food desert areas in census tracts. We have 5 farm markets we've been running through the summer. Those are also in food deserts that we were able to identify, knowing we could reach populations where this was truly needed. Another area that we use, there's a lot of information, as I'll go into it in a minute, on foreign-born and people with limited English language skills. We found this very helpful, and as we were able to target some of this, we were able to share it with the City of Fort Wayne as a community development block grant for the Language Services Network. And the city was able to use that to justify awarding a $30,000 grant to expand language services out in the community. So there's that information, we're hoping it will be as helpful to you all and many of the other data that's in these 418 pages. So let me go through, we gave you a summary, we had passed out to everybody, of some of the key findings that we thought were helpful. Let me go through some of these. You know, am I pointing at the computer, right? Let me see if you can. Again, you have our mission, and let me try, thanks. And it is our 20th anniversary, which was kind of why, as Dr. Dave said, we really wanted to pause and do a little bit deeper dive. And all this is going to be live on the website this afternoon. We looked at, first of all, what were the vulnerability indicators that we could get actual data on. So these are some of the indicators where we could find actual information we want to share with you. We all pretty much kind of know poverty is a major barrier to living healthfully. And, you know, just a few baseline information. Everything is regarding Allen County, and in the study, everything is benchmarked to Allen County. But 15% of the population lives below the federal poverty level. If you read some of the great work done by United Ways, that's usually about 2.5 times the federal poverty level is their reference, which is where you'll see a little bit bigger number than this one here. One of the things in this study is it goes through and it points out which zip codes areas. And in a few cases, we have some census tract information. But where in the community are the greatest challenges or opportunities for us to do outreach and meaningful intervention? So in 46803, about half of the residents there live below the federal poverty level. So that zip code has the highest percentage of very low-income individuals. 46806 actually has twice as many people are in the whole zip code. It's a large zip code with a lot of people. And they have twice as many people living below the federal poverty level as any other zip code in the county. So in those areas, you could really reach a lot of people. When we're looking at unemployment, now I think it's important to understand that this unemployment, Rachel will get in a little bit further the details behind the study. This may look high because it was taken over a range of time in the last 5 years. More important to look at, though, are the zip code areas where there's more unemployment. We hear in this community that people are looking for workers. We could also be looking at this as talent to be developed. Where could we find people in the community to tap into? But again, 46803, 46802, and 06 in the urban area, there's a lot of people there who could represent talent if we can develop it further. In education, we know that that's an important part of helping people get out of poverty. In Allen County, you know, almost 90% of the residents have a high school diploma or equivalent, but those who don't complete high school, a third of those individuals lack health insurance too. So getting people through high school is important to their health, which is something we are looking at. In the area of 4680306, 467, 4302, and 41, and I've put in there Grable because 02, 03, and 06, as you may know, are in the urban core. But when we look in kind of northeast Allen, there's a lot of opportunity there to impact people's lives as well. But 20%, more than 20% of the adult population has never attained a high school diploma or equivalent. So keep in mind that these are opportunities too, that we could really make a big impact in people's lives. I thought it was interesting that in Allen County, a little over a quarter of the adults 25 years or older have a bachelor's degree or higher. And actually, we're doing better than the state, but we're not doing better than the nation. So again, is it kind of a benchmark just to look at some of the data that's in there. Housing kept coming up as something we really need to pay attention to. The rule of thumb, if you talk to financial planners, is that no more than a third of your income or 30% of your income should be spent on your housing. You need to spend it for other things. So we looked at where are people spending a greater percentage of their income on housing, because that's less funds available for all of the other important parts of living and just necessities or whatever's needed. So 36% of Allen County residents who rent spend more than 35% of income on housing. So that's a third. And it really says to us, rental burden is a major issue locally. We need more affordable rental properties in some of that in this community, and the lack of that will trickle down. As many had conversations throughout the community, people are struggling to do basic needs because they're spending a lot on housing. If you look at homeowners, only 14% of homeowners actually are spending a higher percentage of their income. So it's really the rental population that's really vulnerable right now. In 46806 zip code, more than half of the renters spend more than a third of their money on housing. So those individuals are really going to be struggling with basic needs when you're spending that much just for shelter. Single mother households. We have a long interest of supporting women and children. And so families with young children are more likely to deal with financial struggles. That's kind of known. But we are very concerned that single mother households are at an even greater risk. In Allen County, there are nearly 20,000 households with at least one child under age 1. But about 1/4 of these households belongs to single mothers. If you go into the 46806 zip code, nearly half of the 1,500 households with small children are single mother households. So you look at the most vulnerable populations, where can we make an impact? That's an area in there. Health insurance. Among the population with income below 138% of the federal poverty level, nearly 1/4, about 20,000 people, lack health insurance. 42% of the unemployed population is also uninsured. So if you don't have employment, there's a high risk you're going to lack health insurance as well. And I think the other piece in there that was the minority populations in Allen County have a significantly higher percentage of uninsured. If the white population is 10% uninsured, compare that to the Hispanic population where it's 27%, or almost one out of every 4. So that's really concerning to us. There, you can also see it's higher rates among the Asian and Black populations. There are the minority populations being Black, Hispanic, and Asian are primarily concentrated in 4 zip codes in our community, 03, 06, 07, 16. If you want to do outreach to reach those populations and to work on health insurance or anything, that's probably where you need to be focusing energy. And there are 10 zip codes, though, in which more than a quarter of the Latino population is uninsured. And the two with the highest percentage of uninsured Latinos are 06 and 08. And you look at over 40% of the population there is uninsured if you're the Latino population is concerned. And you'll see in the full 12-page report is a lot more data there. And if you go to the 418 page, of course, you can get even more of this. Health insurance, adults 18 to 65 are the group that are most at risk because of primarily the way Medicare works, Medicaid, and in our community. But the age group with the highest rate of uninsured, again, is the 25 to 34-year-olds, 22% of whom are uninsured. So you got about 11,000 people. HIP 2.0 is doing a great job, but we still have uninsured in this community. So we don't want to ignore those 11,000 people. There are 3 zip codes in which more than 1/3 of the adults are uninsured. And I want to point 46743, that's kind of the Harlan area. And some of the Northeast Allen populations, particularly with the Amish, have a greater level of uninsured. You may see that as you go through the data. But 06 and 03 also have very large percentages of people who are uninsured. Let me talk a little bit about refugees and immigrants, a population we have always enjoyed working with. 6.4% of Allen County's population is foreign-born. And if this map here will show you the highlighted zip codes of 06, 16, 03, and 25, where more than 10% of the population is foreign-born. 46806 is the highest, with 16% of the population foreign-born. When we talk English fluency, there's 34 or almost 35,000 residents or households here that about 10% speak languages other than English in the home. And I thought that would surprise me. I think it was higher than I expected. Nearly half of they also asked the question, do you speak it very well? And that did it further, give you a passable English or not. So the kind of the quick boil points out of theirs, but 4.9% of Allen County residents speak Spanish primarily in their home. And then you've got the 2.4% speak Asian or Pacific Islander language, which would be the Burmese refugees who are resettled here. But more than a quarter of the Spanish-speaking residents reside again in the 46806 area. There's a very high rate of uninsured, lacking health insurance in these populations. There, a large number of foreign-born uninsured, but 1/3 of the foreign-born population is uninsured compared to 11% of the rest of the population. So it's important for us. That means we do a lot of training of interpreters, so medical interpreters, so that you can get access to population, and we appreciate all the partners in the room who've been helping us with that. Food deserts. This was an area that kind of startled us a little bit at its overview. There are 37 census tracts that government has identified as being designated as food desert. And there's a lot of criteria for what is a food desert, and that is in the paperwork that we've given you. Income is a factor in there, as well as your distance, geographic distance, either walking if you're in an urban area, driving if you're in a rural area, to a grocery store that serves all 4 food groups, okay? We have 37 census tracts that have been designated as food deserts. On the map here, that's all the little blue areas. We were startled at how much that was in this community. But when you took the census, the number of people living there is 110,000 people. That's nearly 1/3 of our community lives in a food desert. So when it's an issue for many people out there. There's another definition that we're also been paying a lot of attention to coming out of the health community, and that's what we call food insecurity. And the American Academy of Pediatrics has a long definition, but it very quickly kind of boils down to, if you've got a child, it means a child says that they've gone to bed hungry in the last couple of months. If it is a family, they've said they've run out of food or worried about running out of food. Those are kind of the questions that the medical community has used as a part of their assessment to identify food insecurity. In Allen County, we have 51,000 residents who are food insecure, which is a lot of people. And those of you working in food banks and food distribution businesses in this room, this probably is not surprising. But 1 in 5 children locally are struggling with food insecurity, and I think that's an opportunity we can all improve upon. The full study is on our website. I'm going to turn it now over to Rachel, who's going to really explain the study. Those were the highlights, some of the key findings that are influencing us in our grant making, our programming, that we wanted to share with you.
Good morning. I'm Rachel Blakeman. I'm the director of the Community Research Institute at Purdue-Fort Wayne. And thank you for being here today. Meg did a great job of summarizing what some of the findings were of this. I'm going to walk you through on better understanding the mechanics of the report, how you can use it in your agency to make sure that you understand what's on the page and what it actually means. So I appreciate the opportunity to do this. Just a background on us. We have been in existence since the 1980s. We've historically focused on workforce development and economic development. When I came on board last year, one of the focuses I wanted to take a look at, and my background as an attorney, but also as a community member, is better understanding, helping nonprofits understand data on this. So like I said, the full report is on the website. It's 418 pages. You are going to download it as a PDF. This is very important. You will need to turn on the headings function in your browser and whatever you're using, like Acrobat Reader or whatnot, because that's how you can actually find things in a 418-page report, so you're not flipping through it. So what are some of the things that are in this? And so Meg has already done a good job of explaining what some of these things are, but I want to walk through those to help you better understand that. So we have these general indicators that we have it with using Allen County as the benchmark. When I look at things, I always want to be able to, what am I comparing it to? So here we are comparing the information to Allen County. And so we've got some of the key ones that we're looking at are health insurance and languages. We also then, and we'll talk about it in just a moment, about what we call ZICTA, zip code tabulation areas. We wanted to look at those that have the median household income is below that for Allen County. Then we also have information about the lowest and highest, the lowest household incomes by the 10 census tracts, and then the highest with the percent below the federal poverty level, and then, as Meg has already explained, about census tracts and local food deserts. So I'm going to give you a few notes here, especially as you start to use this information in your respective work. We have very detailed information here, which is great until you start using it, and then you go, oh my gosh, this is really detailed. So this is not light reading, so be prepared to spend some energy understanding this. We have definitions in the methodology. It is very important if you are trying, I think we might have something in there about this, but I'm not sure. But like disability has a very different definition. So you will want to look and see how are they what does the definition look like? That is in the 418-page report. It is in the methodology section. Spend some time. Like I said, it takes some time. And the other thing is also don't jump to conclusions about this. Truly try to understand what you're looking at. One other piece is the universe of the people that we are looking at. So for example, when we're looking at educational attainment, that is for the population that is 25 years and older. So that means if you are a 23-year-old college graduate, you are nowhere to be seen in that universe. So just so you're trying to understand that when you're making those decisions and better understanding it. So we used 2 data sources here for this exercise. All of the information outside of the food desert came from the American Communities Survey with the Census Bureau. And so it's a 5-year data set. It covers the years 2012 through 2016. And so this actually, the long form, it replaced the long form, and it is an incredible treasure trove of data about our communities. And then for the food desert, we use the Food Access Research Atlas, better known as the Food Desert, and that information is from 2015. Now, one of the things that we looked at as we were kind of coming up with the list, and this isn't actually in the report, but I just like to highlight this, are the social determinants of health. So when we think about health, we are often thinking about measures such as blood pressure or exercise or those clinical measures, but there's also some other things. So key on this, economic stability, the neighborhood and physical environment, education, food, a community and social context, and then the healthcare system. So the ones that we were able to measure here were things such as economic stability, education, the neighborhood, and then food. Those social contexts are a different set. Those are much more individualized. You can get it on a population level, but that's not a socioeconomic indicator. And then the healthcare system, that's a whole separate universe that's outside of the information that we have from ACS. So I wanted to give you some understanding of what you're going to look at when you actually go and look at these tables. So we have them coordinated in 2 ways. We have the indicator tables and we've got the zip code tabulation table. So what it means is if you want to look at educational attainment by zip code, we'll have the educational attainment % with a bachelor's degree, and you will see all of the zip codes listed for Allen County. Then if I want to say I live in the 05, so I'm a little partial to better understanding my neighborhood. If I go then to the 05 page for 46805, then I see all of the indicators assembled by that respective geography. And this is also in the heading, so that's how you can navigate it. So if you either want to look up your own neighborhood or if you have zip codes of interest, that's how you can do it. If there are indicators of interest, then you go to the indicator page. Okay, so for some of you, this may bring back bad memories of statistics class. And I'm a lawyer, so I really try to avoid numbers, but these are unavoidable here. So we have included the margin of error in the report, and there's some good reasons why we did that. When we talk about margin of error, it's a plus or minus number. What we like to say is the answer is somewhere in there. The ACS data has a 90% confidence interval. And so we've included it on these charts. We included it because if you're going to be making place-based decisions, sometimes what you're going to see is that it's within 2 numbers are within the margin of error. That means statistically they are equivalent. So there's a reason why they picked the number that they did, but there's also value in looking at that margin of error. So there's a plus or minus. What we also want to notice, you're going to see on some of these, especially when we're talking about small populations within small areas. So if I'm going to be looking at the Asian-speaking population in the Harlan zip code, it's a very small number of people, that margin of error is going to be kind of gigantic. So every once in a while, we'll see numbers where it's somewhere between 0 and 100% when we look at that margin of error. So what we know, though, is that it also tells us it's a small universe of people. So it's either because there was a small sample size or because they didn't get responses from the folks that they asked. So these are some of the general indicators that we use, and we've already kind of hinted at some of this based on the information that Meg provided to you. But we have population, race and ethnicity. For those of you, many of you probably already recognize the distinction on that. Race is going to be white, black, Asian, Pacific Islander. Ethnicity is Hispanic. So you can be an Asian and Hispanic, because Hispanic is actually an ethnicity and a country of origin. Educational attainment, we looked at that both on the less than high school and then college. Income, we have median and average, just to make a distinction on that. Median age is interesting. That's also very valuable because it tells you, is the population aging or is the population getting younger? Are you having babies or not? There's average family and household size. So the distinction between family and household. So when I first moved to Fort Wayne, I lived with 2 roommates. So we were a household, but we were not a family because we are not related to one another. We are not related by marriage. We do not have children. So that's a household. So a single person household is exactly that. They are not a family. So a family then has to have some sort of marriage or children relationship there, blood relationship. Foreign born. That means that it sort of sounds exactly like what it is, except for the fact that it means you were not born as an American citizen. So if you were born of American parents in Germany, you are not considered foreign born. You are native born because you were born as a citizen. So foreign born is a non-citizen at the time of birth. Language is spoken at home and health insurance as well. So here's just some of the findings that we had, and obviously you've got a much better report from the good folks at the foundation. I think this is interesting, that there was no single zip code that best represents Allen County. So you can't say 08 is Allen County, 05, New Haven. When you look at the numbers, each of them come out. What the Allen County number is, it varies throughout. There's a strong correlation between a college degree and household income. There's much less so for high school diplomas, or less than high school. And I think that may be also partially offset by the fact that we have a large Amish population in Northeast Allen County who actually have relatively high household incomes because of the way they've structured their economy and their workforce. But so it's interesting to see where the relationship was. Overall, the household income is higher than the median income. So that really means that the top earners are bringing the middle up rather than the median, which is the middle point. As you know, half of the people earn more and half of the people earn less. We've already touched on this, but 03, essentially half of the people are living below the federal poverty level. And we have 3 zip codes that are majority minority, 06, 03, and 16. A few other items. Low-income households are correlated with a higher minority and non-English speaking populations. That Asian and other languages have the lowest English fluency and proficiency skills. Above half of the English speakers actually speak English well. And as we've already noticed, the large number of uninsured in the Amish populated zip codes. So here were what we call those deep dive zip codes. And these were the ones that have the median household income below Allen County. For those of you who are saying, well, why do you have Decatur on there? That is because we included every zip code that touches Allen County. So there are people who live in Allen County who have a Decatur mailing address. There are people who live in Allen County who have an Auburn mailing address. So those outlying zip codes, when you look at that information, it includes the folks from those cities that are outside Allen County. So when you look at the Auburn numbers, you are looking at a majority of them from DeKalb County. So just keep that in mind. There are not a lot of them, but just keep that in mind. When we look at the Allen County data, that is Allen County exclusive residents. So if you are that Allen County resident with an Auburn mailing address, your information is going to be included in Allen County. And so, as you can see, when we look at those the median household income below Allen County, you're going to be looking at mostly Central City. So 02, 03, 05, 06, 07, 08, whatnot. Also, I'm seeing a lot of folks from social service agencies, so I'm anticipating when you see those numbers, you know where they are on the map. If you are not as familiar with it, we do have a map of all of the zip codes in the report. So a couple of other additional indicators that we looked at: or the percentage of housing costs, single parent households. We also looked at the age of the housing units, so that way, what's important about that, it gives us a few indicators. Sort of how old are they? Because sometimes it's just useful to know that. But also it's important for the fact of exposure to lead paint. So that was eliminated in 1978. So newer housing does not have lead paint. Older housing does. So that's useful. We also have the number of single-person households, and so that gives you an indicator of some variety. So are they a single-person household because they graduated 2 years ago from Purdue University? Well, then it would have been IPFW, and they're living alone. Or are they an older person who may need some assistance? And those below median household income are not always underperforming the Allen County measure. So that's important, and we have that listed in the report. The report is listed so that when you look at it, the most vulnerable are at the top of the list. We have sorted it so that way, if the highest was the worst, then it goes from high to low. If the worst was lowest to high, that's how it's been sorted, so that way it hopefully helps you. When we were working with the St. Joe Community Health Foundation, they wanted to identify those, so we wanted to make it easy to figure that out. So here's something with the 10 census tracts with the lowest household income. We excluded one of them. This is actually the zip code or the census tract where Purdue Fort Wayne is. It has a very small number, and we just left it out because it wasn't representative of larger numbers. But you can start to see that the income, the median household income for census tract 17, right here, it's going to be probably thereabouts East Central, is $18,459. That means that half of the households earn less than that. And that's compared to a median household income of $59,500 for Allen County. So you can see where that is. What I think is interesting here is that when we compare it against the federal poverty level, and so I wanted to include this for just a moment just so you can better understand. When we say poverty at the Community Research Institute, we use the federal poverty guidelines so that so either you are in poverty or you are not, and it is only an economic measure, and it is a household level measure. So the larger your household, the more likely you are to be in poverty, because it's, like I said, so if we look at this, in 2015, the average Social Security benefit was $16,000. So a single person household receiving Social Security is actually probably less likely to be in poverty because they're one person, and but look at it when you get to a four-person household, then we are I'm using the 2018 federal poverty level. We're at about just over $25,000. So you can notice how the larger the household size, the more likely you are to be in poverty. So then when we look at this, these are the 10 census tracts with the highest percentage below FPL. We did exclude another census tract here in this because it was actually out on West Coliseum Boulevard, and again we thought was kind of an unrepresentative. It had a really small number of households. So we left that out. But so if you're looking at it in terms of this, census tract 31. So now we're moving. Census tract 17 had the lowest household income. Census tract 31 has the highest number of people percent living below federal poverty, and we're looking at about 53%, half of them. But if you notice that percent living below poverty, they're actually statistically all kind of about equivalent, somewhere between 43 and 53%. So what we thought was interesting, and as I was telling you about that, it's household size drives poverty. There's actually only 5 census tracts that fall in lowest household income and highest poverty. So I think that was one of those surprising, you would sort of think they would probably be the same. They're actually not. There's 5 that overlap. So let's talk about access to food using the USDA data. So this is from 2015, as we had already noted. And these were, we thought when we were actually looking at it, Mark, our full-time researcher, and I, we were trying to look back, and we thought, we don't think that there's been many changes in the number of supermarkets, so we think that this data is probably still fairly accurate today on that. So there's two things that you have to be a food desert. You have to have low access and low income. So when I look at the census tract in which I live, we actually are, by distance, meet the food desert situation. But our income is high enough as a census tract that it bounces us out of that scenario. There's also multiple ways to measure a food desert, and we'll talk about that here in just a moment. So this is what we're looking at in terms of distance exclusively. So again, you have the low income and the low access, and you have to either be a half mile or 10 miles based on whether you are an urban or rural location. So you can start to see some of this. So like this pocket of Forest Park, Lakeside Park is not. This area is actually George's International Grocery qualifies as a food. We do not actually get a list of that which qualifies as a full service grocery store. They do not publish that, but I did reach out to the good folks and they can't tell me who's on the list, but Asian grocery stores probably do, the Asian markets on South Calhoun probably do not count in the food desert calculation because they don't have enough dairy products that they sell. But George's probably does, based on what we could figure out from here. So you can see that. Then also there's another measure that looks at it by low vehicle access. So again, we have an income factor, but do we now have households without vehicles? And so this is the low vehicle access census tract map. And so in sum, I'd just like to say that I appreciate the opportunity to work with Meg and her team on this. I think that there's a lot of value in what we have out here for you to be able to use. So I hope that you're going to be able to find it useful. If you have questions about this, I have put my card in the back, so feel free to reach out and better understand this information. Also, if you would like copies of spreadsheets specifically because you do not want to type in the data or download it, please feel free to contact me. I will be happy to provide that information. So I think it's really a valuable tool to make those informed decisions. And with that, I would be happy to take some questions if anybody has them. Oh.
Because this has come up a few times. As you saw, the data was 2012 through 2016, and we talk about the new census coming out. Can you explain, will this data be old next year in the new census, or how do we look at that?
Sure. So what is going to happen is that actually tomorrow we get new ACS numbers, what are called the one-year ACS information, which actually doesn't apply to most of this because this we had to use the 5-year for reasons of the population size. So we'll get new numbers that will come out in December. But what you can't do is compare 5-year numbers within the same 5-year data set. So you can't look at 2016 5-year data to 2017 5-year data. So you have to wait until another 5 years before we can start making comparisons. We also think that the data is going to have some longevity because of the fact that when we look at the local economic situation, not much has substantially changed year over year. So it would be one thing if we had had a large employer loss, such as what happened when we lost Harvester many years ago. That would have been a substantial change. Or if we were to get Amazon HQ2. So that would then instantly bring in a large number of high-paying jobs, good or bad. We think that we're pretty steady so that way the numbers, even though new information will come out in December, we think this information has some longevity for some length of time. It's not a light project to take on to do this. So we discovered when we were doing it why no one else has. And so you are certainly welcome when the new information comes out to look it up in December if there's something. But I would continue to use the data for a number of years for this. I think that there's reason to believe it will work.
I would just add to this is we've spent time working with this data. When you look at it tracks very specifically over 5 years, so taking that 5-year, you get a pretty clean pattern. What's really valuable about this data, the numbers may shift a little bit up or down a few percentages, but most likely the geographic zone, what's happening in those zip codes, you're not going to see a change. So for those of us who are trying to really figure out strategically, how do we use our resources? How do we, people, money, projects, et cetera, this should be a very helpful tool to inform you where to go geographically, where do you do your outreach, where do you place a program site, to reach populations that you're trying to reach. If it's a specific language group, if it's a specific insurance, if it's a household, it would help. This will tell you geographically where to go.
I have a question. Looking at the data and the social determinants, I really think that has a direct correlation on our infant mortality. So when you were looking at the numbers in the report, anywhere in the report, did you work on some correlation between the housing, food deserts, and our infant mortality in those 46806 and 05 zip codes?
We looked at it.
Yeah.
One of the things that 46806 has been a community that has an extraordinarily high infant mortality. Statewide, it's been pulled out quite a bit. So we actually have studied 46806. We've been actually sharing the information with Parkview as they've been doing some of the outreach on their project as well. The best answer is there's not an easy bullet for this one here, but we also know infant mortality is an indicator of the overall health of the mother and the family. So when you start going in, as she said, you can go in by zip code. You can really see what's going on in that neighborhood. In that 46806, you also realize it's a very large population area with multiple at-risk factors happening in there. So I think the better way to say that is you can go in and study what's happening in the neighborhood. That's a very easy search in here. You just look up 46806. It'll tell you how many residents, how many races, and all the different indicators. It's probably the easiest way to do it from there.
Yeah, we had actually looked, obviously this has been an interest of the St. John Community Health Foundation is infant mortality. There's not a particularly single good indicator for that. So you have to look at some of the other factors, household income, housing costs, housing age, some other things like that, because we don't have good natality information about mothers. It's just, part of it is also the universe is so small. The number of women having babies in a particular zip code is actually a relatively small number, so there's not any particularly good questions asked about it, so you have to look at it in a larger sense.
One of the things, I'll get to your question, I think that you raised that we spend actually a lot of time on infant mortality, looking at it. Health and diagnosis groups, we really depend on the State Department of Health to define what's going on geographically. So if you know they will go through and they define, like 46806, there's more deaths. They have the data on birth rates, death rates. They're the ones who collect it. This actually doesn't get into really health diagnostic. It really is the social determinants of health. What's happening in those communities? So this you really need to complement with the other. We actually have done it internally. We chose not to include it in the study because we thought we didn't want to start adding in a whole lot of additional data sources with assumptions. So I think that's just important to know is that for us, we are taking information from other great sources who are specializing it, and they may pinpoint at a neighborhood. But locally, we're the ones charged with, everyone in this room, delivering services locally. So to understand what's happening in those communities, in multiple ways, whether it's food, whether it's housing, education, all those things we know impact health. We thought that was important information to get out there. So that's really where the study is a little more focused. You have a question?
Basically answered my question. I was going to ask if you were using the same sort of mentality for addiction and the opioid crisis.
Yes, because other groups have really collected that data. So if you have some information and they can get you to some indicators, it's better to come in here to really study the neighborhood. If you are doing any kind of a program outreach or you're trying to figure out where to do it, this is going to help you more geographically pinpoint and how to best use your services, do those services in that neighborhood. Yeah.
How about eviction? I've just recently completed reading the very difficult book, Eviction, which everybody in this room should read. But do you have any statistics on eviction rates or repeat evictions?
That's actually not in, so the question, just for the recording, the question was about the eviction rate in Allen County. So that is not actually information that is collected by the American Community Survey. So because of the fact that that's going to be a judicial action, that's going to be a separate universe of data. So you would want to then go to Allen County courts to get information about that. They don't ask whether those people whether the respondents have had an eviction notice or have been evicted. What does tell us, though, is that rental burden. The housing, so when you're spending more than 30% of your household income, you are creating a very vulnerable risk in terms of your monthly financial costs. That's when you're going to be getting in trouble. So that's what's useful. So again, we don't have direct information, just as we don't have direct information about infant mortality. We do have some indicators that help us better understand those who may be at risk for eviction simply because they have low household incomes and the amount of and not only low household income. It could be that you have a relatively high household income, but you have a relatively high housing cost. So that way you may be making $35,000 a year for your family of four. You are not below the federal poverty level, but you may not have been able to receive any sort of housing assistance programs. And so if that's taking $1,200 a month, you're now putting your family at risk because you don't have that margin.
What about the correlation with crime, specifically homicides? We saw that the 06 and the 03 are some of the most vulnerable people, and incidentally, that's also the area that has the highest homicide rate, at least from what I've observed. So, I mean, do you think it's desperate people do desperate things, or do you think there is a correlation? Okay,
so just to repeat for the recording. So the question is about crime rates, specifically homicide in the 06 and the 03. That is outside the universe of this project because that would be uniform crime data from the FBI, uniform crime reporting. So we do not have that information in the exercise of this report.
One of the things that I think would be very helpful for you to do is this afternoon, it'll be on the website. You can open this report. If you go into, like you just said, 46806 and 46803, one of the things that's a very easy study is you can open up 46806. Look at the number of residents in there. Look at the makeup, all of the different vulnerabilities, and you're going to start understanding why both the opportunities and the challenges in each of those areas, in those communities. And suddenly it starts becoming clearer why certain things why people are more vulnerable in those communities. And it's a very easy thing to do, but it was pretty interesting to me that I took my home zip code and I took an urban zip code, just the two of them, because I knew my neighborhood. And I kind of knew one of the neighborhoods, and I was surprised at the number of residents in each, all the different characteristics, the difference between income. And as one of the things Rachel said was, no one zip code represents Allen County. And the more we worked at it, the more that really startled us. 46806 is very different than 46802 and very different than 46803. So if you're right, we find these statistics on homicide, we have all of these, you really go to the next step if you want to figure out what kind of programming, what kind of outreach. You have somebody in there, you're working with something in there, you will see pretty quickly and easily with these charts what's going on in those neighborhoods. It's a very different cultural experience within it. And I think that's what we're finding can help us be better informed on our decision on how to use resources. And that's what we think will be very helpful to the people in this room. Andrew?
Do you have directions on how to cite the information?
The question was how to cite the information. Actually, all of the tables are noted, so you know exactly which the table number is in the report, so you will be able to find it. All of this was public information from ACS, so if you want to go in and pull it yourselves, you are welcome to do so. It'll be a little challenging, so I'm happy to share it with you, but yes, you can look it up and properly cite it. Susie?
When you did the surveys of the populations and they answered a certain way on their questions, did it ever drill down any further as to the why?
No, the question is about the why of how they answered. Typically not. It is simply asking, and what many of them are, so such as the housing costs, it doesn't ask, does your housing cost more than 30%? The question is, how much is your income? How much does your housing cost? And then they do the calculations for that relationship between the two.
I was
And-
really thinking about the uninsured, especially the high levels of children uninsured, to me is the why, but we have the programs we have.
Yeah, so
it's just-
no, they do not ask that. You can actually get a copy of the ACS questionnaire online, which is actually fairly interesting if this is your thing and you want to better understand it. You can see how they ask all of the questions, but there is no intent. It is simply a factual inquiry, yes or no, how much, that sort of thing. Tony?
Richard, does the study at all address caregiving or child care in the zip code areas of what's available for families?
No, we actually tried to get a little bit deeper into some of it, and we couldn't find a good source on that one. You're going to just find number of individuals in the household, and you're going to have to kind of work it from that perspective.
The question was about childcare, so yes. Are there any other questions? Well, with that, thank you very much. I'll be staying afterwards to answer any questions, and I'll hand it off to Meg for the farewell.
We hope this is helpful to all of you all. It's helpful for us, but I'd also encourage you, please reach out to Rachel or to us if you need some help using it. And yes.
Is Rachel's last name, which I missed, email?
I have my card from the back.
Thank you.
But thank you all for your time this morning and for all the work you guys are doing in the community. We appreciate it. Thank you.